Hey there guys, it's Dr. George here from thehealthybear.com, and I'm making this video as a reply to Chemicalism, who had put up a question on Twitter about the connection between SSRIs or antidepressant medication and drops in blood pressure. Just to go back one step to explain, in our body we have a mechanism that's designed to help keep the blood pressure nice and even, and we need to do that because the blood going to the brain needs to happen at a fairly constant level. So what happens is if we're lying down and we go from, say, lying to sitting or lying to standing, there can occasionally be a brief drop in blood pressure, and that leads to less blood flow to the brain, which makes us feel dizzy, woozy, a little bit faint, and in some people can actually faint. So there's a mechanism of part of the neck here that when there's a drop in blood pressure, what will actually happen is the heart will speed up a little bit, and that will increase the flow of blood to the brain, which will help ensure that we have enough blood there to keep us going. Now, interestingly, in depression, we know that that system doesn't work as well. So there is an increased chance of having drops in blood pressure when you go from sitting to standing with depression. But if we add in medications to treat depression, that can actually make it a little bit worse. And that is called autonomic dysfunction. So we know that in particular, there's a couple of drugs, and that's SNRIs. So they're serotonin noradrenaline reuptake inhibitors, and that's in particular like Effexor, Prestige, and Androdax. They are associated with some instability of the autonomic system, and to a lesser degree, but still present, is some of the SSRIs, which are pretty much the standard antidepressants that are on the market at the moment. What can we do about it? People are all different, so occasionally changing occasionally changing antidepressants will make that better. So make sure you talk with your doctor. But the other thing is that your body does pick up the increase in blood pressure when it needs to. So the basic thing is make sure that you go from sitting or lying to standing in a slow fashion, and perhaps holding on to something initially while your body's getting used to this phase. So, you know, say you're getting out of bed. So sit up in bed with your legs hanging over the side, wait, 5-6 seconds, then stand up. Also in summer, make sure you keep up your fluids, because hydration is a really important part of this as well. Look, I hope that this has given a bit of an answer to your question, and I hope you find it useful. Have a great day. See you, mate. Bye.